All right. We always have to define our basic terminology and make sure we're on the same page with that. I'm sure that a lot of these terms, many of you have heard before, but we're going to go through them. So when we're studying body systems, we can study them on the gross level, which is the organ or system level, or on the microscopic level, the cellular level. So the book is organized by the organ or system level, and the modules are organized accordingly, but we will also discuss things on the microscopic level. A biopsy is the excision of a small amount of living tissue, usually for a histological examination. It's usually an outpatient procedure that unless they're taking a biopsy of your liver or something where they have to go in a little deeper. But an autopsy, on the other hand, is examination of the body and organs after death. Certainly not an outpatient procedure, but a lot can be learned from an autopsy, and a lot can be seen on the effects of disease on the body and organs. So it's definitely a valuable type of examination to be done. It doesn't do the person who's having the autopsy any good, but hopefully we can learn from it and go on from there. So there are some terms that are used to describe the disease process. Diagnosis is the identification of a basic disease. Evaluation of the signs and symptoms and the laboratory tests. People often ask me, what is the difference between a PT and a PTA? And what I always tell them, it's always nice to have an answer ready because you get asked this a lot. But I tell them that a PTA is licensed and trained in all of the physical therapy interventions, but we do not do evaluation and diagnosis. The PT does evaluation and diagnosis. So a PTA always works with PT, and the PT does the evaluation and diagnosis and comes up with the plan of care, and the PTA applies the appropriate interventions. So the etiology is the causative factors in a particular disease. There may be one causative factor, or there may be several causative factors. So lots of different things can cause disease, and there is a listing here, not necessarily comprehensive, but fairly complete. Congenital defects, things that happen at or around the time of birth. Inherited or genetic disorders, you're born with it because it's in your DNA. Microorganisms, bacteria and viruses. Immunological dysfunction, so things that your immune system causes. Degenerative changes, arthritis, osteoarthritis is a really good example of a degenerative change. Rheumatoid arthritis is an immunologic dysfunction. Malignancy is a tumor or neoplasm new growth. Metabolic or nutritional problems, an example of a metabolic problem might be pernicious anemia, which is a B12 issue. A B12 deficiency that's caused by the loss of intrinsic factor, which helps digest B12 or produce B12 in the digestion process. Diabetes is also a major metabolic disease process that we deal with a lot. And trauma, burns, and environmental factors can also cause disease. So when those are the etiologies of disease. When we're talking about what caused it, is it caused by a side effect from a medication or an error in a treatment or procedure? Idiopathic means the cause of the disease is unknown. So one of my friends and coworkers likes to say to patients, idiopathic is short for idiot pathology, which means the idiots don't know what caused it. It's kind of silly, but it's a good way to remember that. So an iatrogenic cause is something that's caused by an error or a treatment or procedure causing the disease. So the example that they give in the book, which I think is a really good example, is a bladder infection that results from the insertion of a catheter. So it's the procedure that caused the disease, and it's a lot of times iatrogenic is considered caused by medical treatment. You'll also hear the word nosocomial, and that we'll talk about that in the infection chapter. Nosocomial is an infection that is acquired in a healthcare setting. So you could say a nosocomial infection is iatrogenic because it's caused by treatment or procedure. Like having to go into the medical setting causes you to catch the pathogen that causes the disease. So if you want to nitpick about it, predisposing factors are things that make you more prone to get a particular disease. So some of them, of course, can be changed. Some of them cannot be changed. You can't do anything about your age, your gender, your DNA. You can certainly change your environment, largely. And we'll talk about predisposing factors for different diseases that we talk about. Prophylaxis is measures taken to preserve health or prevent the spread of disease. So you might think of the example given in the text is baby aspirin daily to prevent myocardial infarction in people with high risk of heart disease. So the baby aspirin itself is not treating an existing condition. It's attempting to prevent a potential condition. So prophylaxis, so you could say the baby aspirin is being taken prophylactically to prevent heart attack. Prevention, on the other hand, are things like vaccinations, dietary and lifestyle changes, prevention of potentially harmful activities like don't go skydiving without a parachute. That's a good way to prevent trauma. Pathogenesis is the development of the disease. So it is the sequence of events involved in the tissue changes related to a specific disease process. The onset of disease, it can be sudden, which is classified as acute, or it can be insidious, gradual, vague, or mild signs. So a heart attack, for example, a myocardial infarction, that is a sudden onset of the disease. You have distinct signs that happen suddenly. And an example of insidious would be multiple sclerosis or arteriosclerosis. It's a gradual onset, vague or mild symptoms, signs. So your doctor might do blood tests and see that your cholesterol is kind of creeping up, but it's not anything that happens on a sudden basis. So you could have a gradual or vague or insidious onset that then results in an acute, sudden change, such as a myocardial infarction. So acute disease is, a lot of times it's short-term, develops quickly, like a high fever or severe pain. The flu is an example of an acute disease that's short-term, so it has its course. It's not going to persist forever. It develops quickly, and it could have severe symptoms, severe or mild symptoms, but a lot of times acute diseases have a little more severe. Chronic disease develops gradually. The symptoms are often milder and often intermittent with acute episodes. So chronic disease might be like chronic bronchitis. The disease process is kind of going on all the time, and then things can exacerbate it, make it worse, to trigger an acute episode. So the subclinical state is where there are pathologic changes going on that have no obvious manifestations. So we can't we don't know that there's a disease process going on because there's nothing to tell us that it's going on. We can't, it's not going to show up. Sometimes people will start having symptoms, some unusual symptoms that eventually get diagnosed as multiple sclerosis before they have clinical signs. That's not necessarily a subclinical state because they're having symptoms, but there can be disease processes going on before you know about them. Parkinson's has an insidious onset, and the cells involved start dying off, but you don't notice any symptoms until about 80% of them are gone. So there are pathologic changes going on, but there are no obvious manifestations for a really long time. So Parkinson's has a very long subclinical state. A latent state is where there are no symptoms or clinical signs evident. In infectious diseases, that's often the incubation period. There are some infectious diseases, such as tuberculosis, that have a latent state where the bacillus itself has gone into a latent state, so it is it's encysted in the lungs, but it's not actually doing its thing, and so you're probably not, I'll have to look that up, whether you're infected during the latent state of tuberculosis. But in some diseases, you're not. The prodromal period is early development of the disease, where signs are non-specific or absent. So when you think about you're getting a cold, there's that day when you just don't feel right. You don't quite feel sick, but you don't feel great either. So that's that non-specific or absent sign. You're like, I might be coming down with something. I don't really feel great. Unfortunately, during the prodromal period with things like colds, a lot of times you are infectious at that point and you can make other people sick. So a lot of people won't call in sick to work when their signs are non-specific. That makes sense. But then they go and infect a bunch of people and then they call in sick the next day. So the manifestations are clinical evidence with signs and symptoms. So in the prodromal period, you may or may not have any, and certainly in the latent state, the subclinical state, you don't have any manifestations. But then when you finally have some clinical evidence, the signs and symptoms can be local at the site of the problem. Like say you have an abscessed tooth and you have tooth pain right there. Or they can be systemic, like fever. Fever or body aches, that's another systemic symptom that you'll hear. So with regard to signs and symptoms, signs are objective indicators of disease. They're things that we can measure. Blood pressure, pulse, heart rate. Oh, pulse and heart rate are the same thing. Sorry. Temperature. You can take a culture and grow bacteria. That's a sign. A symptom is subjective feelings, like I feel nauseated and body achy and I have a headache. Those are symptoms. My knee hurts. That's a symptom. A sign, you look at the x-ray and you see arthritic deterioration of the knee. Or you look at MRI and you see a torn ACL. So one's a sign, the other's a symptom. Objective versus subjective. Lesions are specific local changes in the tissue. So for the example of the torn ACL, the lesion is that ruptured ACL. For other things, so any specific local change in tissue is considered a lesion. A tight, scarred area in the muscle is a lesion. Any specific local change. So a syndrome is usually a collection of signs and symptoms that can be classified together. So it might not be a specific disease, but it might be a syndrome. And we'll talk more about that when we talk about individual things. Diagnostic tests include various laboratory tests that are appropriate to the manifestations and medical history involved with that individual patient. The acute care section of the APTA put out a really good learning module on lab values, which I've included a PDF of that in the module if you're interested. There's an article discussing it. There's a lot of different references. There's a quiz, and my favorite part, there's a chart at the very end that talks about individual specific lab value changes and how it affects therapy. For example, if someone has really low platelets, you don't want to do a lot of activity with them because you can cause them to bleed internally. So that's a bad thing. So not every PT or PTA looks at laboratory tests. I'm pretty fond of looking at laboratory tests because, number one, they tell you a lot. And my first job ever, I worked in a hospital chemistry lab, so I'm all about the lab values. I'm like, well, what do they got on the labs? And a lot of times when I was working in acute care, my coworkers would look at me blankly like, labs? And, but that APTA reference is a really good one. And when we talk about specific illnesses or specific manifestations in the body, I will refer to that in some different therapy implications. So remissions and exacerbations mark the course or the progress of a disease. So a remission is a period in which manifestations of the disease subside, and exacerbation is a worsening of the severity. So in cancer, for example, when a person's lab values go back to normal, their symptoms subside, they're considered to be in remission. And we'll talk about this more next quarter when we talk about cancer. But if you're in remission for a certain period of time, you're considered to be cured of the cancer, which is awesome. There are some diseases, such as multiple sclerosis, that can have periods of remission and exacerbation where the symptoms are less and then the symptoms get worse. Sometimes people will refer to that as a flare. There are other diseases and syndromes such as fibromyalgia or lupus where people have relatively stable periods and then flare periods where their condition is worse. A precipitating factor is a condition that triggers an acute episode. So for a lot of diseases that tend to have exacerbations and remissions, such as MS or fibromyalgia or lupus, stress can be a big trigger for triggering an acute episode. There can be other precipitating factors, but it's just it's a factor that triggers an acute episode of a disease. Complications are new secondary or additional problems that result from the original disease. So a good example of that is any disease that is treated with corticosteroids, long-term corticosteroids, and there are lots of diseases that are treated with that, inflammatory processes, can develop a secondary complication of osteoporosis because the corticosteroids affect calcium metabolism. So a complication is just a new or secondary additional problem that resulted from the original disease. So therapy, of course, when we say therapy, we mean physical therapy, but it doesn't just mean physical therapy. Therapy is really any therapeutic intervention or treatment measures that are used to promote recovery or slow the process of a disease. So it might be surgery, drugs, physical therapy, alternative therapies, behavior modification, anything that is promoting the recovery or slowing the process of a disease is therapy. So we have this little thing on our refrigerator in our staff kitchen that says therapy is, and it says listening is therapy, kindness is therapy, a good receptionist is therapy. So everything we do can be therapeutic, can promote recovery or slow the process of someone's disease. So don't think of it as just being one thing. It can be any measures taken to promote recovery. Sequelae are potential unwanted outcomes of the primary condition, such as paralysis following the recovery from a stroke. So You might be treating someone for the spasticity following a stroke. You're not necessarily treating them for the stroke because it's already completed. And we'll talk about that when we talk about strokes. But you're treating them for the sequelae of a stroke. So you can think of it as the sequel. It's like in the first movie they had the stroke, and in the sequel they went to physical therapy to treat the potential unwanted outcomes of it. So the convalescence or rehabilitation is the period of recovery and return to a healthy state. And I just found this George Bernard Shaw that says, I enjoy convalescence. It's the part that makes illness worthwhile. So if from a physical therapy standpoint, the rehabilitation, that's our part. We get to help people get better. We get to help see people return to a healthy state, and that is awesome. So when we talk about the prognosis of a disease, the prognosis is the probability or likelihood for recovery, or what the other outcomes might be. So a lot of times prognoses are based on what happened to other people. What is the normal course of the disease? A lot of them are based on clinical studies. So in the epidemiological studies and clinical studies, we use some of these different terms, and we'll talk about this a lot. So morbidity is the disease rates within a group. So a lot of times we'll talk about people who have comorbidities, meaning they didn't just have a stroke, they also have heart disease in relation to that. So it's and they have diabetes, and they have whatever. So whatever additional things the person also has in relationship to the disease you're studying or working with, those are comorbidities. Mortality is the relative number of deaths resulting from the disease. So one of the really interesting, or I guess encouraging things that you can see as a result of cancer research and new treatments being developed, when I was in college in the 80s, the mortality rate for leukemia was something like 95%. It was very high. And now the mortality rate for leukemia is about 5%. Huge, huge difference. So the prognosis for the disease has improved with improved treatment. So that's pretty exciting. And, I'd like to see that happen with other diseases too. We talked about the autopsy. It's the post-mortem examination. Sometimes you can tell about the disease prognosis from other people's autopsies. Epidemiology is tracking the pattern or occurrence of the disease. So the World Health Organization and the Centers for Disease Control are major data collection centers for epidemiological data. When we talk about the occurrence of disease, we're going to refer to incidence and prevalence. So incidence is the number of new cases in a given population within a given time period. So sometimes we'll say that a certain number of people, a certain number of new cases of this disease were reported within the last year. That's the incidence of the disease. So a significant increase or decrease in incidence is often analyzed by the CDC and the World Health Organization to determine responsible factors, like why is there an increased or decreased incidence? Was there a new treatment developed that's really having a great effect? That would be for decreased. Is there a new etiology that we don't know about, or a new increase in a certain etiology? So, that's a good thing to know. Prevalence is the number of new, old, or existing cases within a given population and time period. So, with prevalence, it's sort of like how many people already have the disease. It's always a bigger figure than incidence. So you can say incidence in the case of Parkinson's, I talk about Parkinson's a lot because I work with people with Parkinson's is one of my areas of specialty. But you can say the number of new cases reported within the last month would be the incidence. The number of people that already have it in the state of Washington, new, old, or existing cases. So, of course, prevalence is always going to be higher than incidence. Epidemics are higher than expected cases of an infectious disease that are occurring within an area. So you'll hear about flu epidemics and E. coli epidemics. So they expect a certain number of cases per year, and when there's a higher number, it's something to be concerned about. It's something to be aware of. A pandemic involves a higher number of infectious diseases in many regions around the globe. So you can say there's a flu epidemic in the state of Washington, or it can be pandemic where it's all over the world. And in this age of international travel and all the different things, pandemics are much more possible than they ever were in the past. Even though, ease of travel didn't seem to affect it, there are certain diseases that became pandemic many times in history. So, interesting. So this is a little graph from the book on prevalence and incidence. Prevalence is the new and old cases. Incidence is the number of new cases. There's a lot, when that peak is an epidemic, it's a large temporary increase. And it's reported as a number of cases per 100,000 of the population. So it's just a way of tracking different diseases. So part of the thing for infectious diseases, the epidemiological data can be used for things like hospital staffing. They might have to look at, wow, there's been a big upswing, there's an epidemic of certain things going on, we're going to need more staffing in order to deal with this. So there are a lot of areas of healthcare that can use that data. So communicable diseases are diseases that are infectious and can spread from one person to another. The guy in the picture, he is spreading. He's spreading some disease via droplets. There are some communicable diseases that are considered notifiable or reportable, meaning that they have to be reported by healthcare professionals to certain designated authorities. And it's going to change depending on where you are. So there might be certain diseases that are considered reportable in one state that are not in another. A lot of times the requirement of reporting is intended to prevent further spread of the disease and to maintain public health. So it can be sometimes sexually transmitted diseases are reportable, certain other diseases, and it's certainly going to vary from place to place what's reportable.